Good evening. Welcome to Sound Health on Lagos Television. I am Ola Sumbo Mudupe. It is 1 year since President Bola Tinubu assumed office as the president of Nigeria. How has the country fared in the health sector? This is our focus today on the program. The conversation begins after this break. Please stay tuned.
The future of global health is digital, and WHO is leading the way by supporting health transformation in countries around the world. The Global Initiative on Digital Health, GUIDE, is a network of organizations, institutions, development partners, and governmental agencies managed by WHO. We aim to ensure nations are sustainably supported to plan, resource, and develop strategies for digital transformation that equitably strengthen their health systems. Our toolbox offers quality-assured resources to bolster the digital health capacity of countries. It includes tools which prioritize national health needs, assistance for countries to avoid the duplication of efforts, integration with existing WHO-led digital platforms, and technical support to scale up digital health solutions. Working together, we can help enable sustainable digital health transformation by providing solid foundations and help create a vibrant ecosystem which enables access to health for everyone.
Let us look at the indicators recorded for nutrition, malnutrition, and deficiency.
The data is out there. We've seen that we're still not doing as well as could be expected from us. We're supposed to be the largest, GDP in Africa. Now I think we've come a bit down. Once we don't have systems in place for basic healthcare, basic nutrition, we're going to have these indicators of stunting. We see it. We still have a very high rate in Nigeria where children who are susceptible to all kinds of diseases, everything, because we do not have that push, that prioritization. It's all about priority, and I always quote this from a local government chairman many years ago who said that health is not a campaignable issue. That's what they said. So, which is a very unfortunate statement, but it's a real statement by politicians. Why? Because you see that they prefer to commission roads, bridges, and be televised live. But how many times will they televise their, giving health coverage to X number of people, or they've employed X number of health workers? That's not so sexy as they say. So we need to understand that the real priority, if you do all these roads, bridges, etc., it's human beings, healthy human beings who are alive that will take those roads, that will build those roads. So I think it's very important that we look at how we ourselves, as policymakers, at the federal, state, and local government level, prioritize the health sector, ensure that our children especially are getting quality healthcare in all aspects, proper nutrition. Right now,
The health sector is still experiencing infrastructure deficit. We are not seeing new structures in place, new teaching hospitals commissioned in the last 1 year.
actually, I am actually very, very skeptical about hospital buildings when we talk infrastructure, because we have so many buildings all over the country, hospital facilities which are practically empty. The hospital is actually not about the building, even though that's the one that I think contractors and our government policymakers may like for the contracts awarding. It's actually about the equipment and the personnel more. We saw during COVID, good example, that many times it was basically like tents that were being used, and it was the equipment that was life-saving, not the building. So I think we don't even need, I'll give you an example. UCH there, they couldn't, there's no light many times. We've had cases where some persons even had to who passed on because there was no electricity. Youth, very abysmal state of affairs there. Lagos University Teaching Hospital. These are very, very old established teaching hospitals, which cannot even be maintained. So I would advise against building anything new. Let us even, those that are existing now, really those teaching hospitals now, let us even begin to upgrade them, to put them up to a standard where people can actually come and get quality health care. That is the priority. The idea of again building without corresponding maintenance, equipping them is actually very unfortunate. I mean, we had, for instance, in Lagos, we had the big cardiac center. Then 4 billion that was budgeted for it, and for years it was not put to use a little bit because they couldn't get the personnel to work with it. And now it's not there. I think they've converted it during COVID to a COVID center. And there are many like that. Let's speak of various health facilities, PhDs that are across the whole place which are not being used. So let us begin to look at those structures that are in place. We should also begin to look at those teaching hospitals that are already there to make them some kind of regional hubs. I know this idea came up before. Upgrade them to the extent that instead of people traveling abroad or anywhere, we have in each region, each geopolitical zone, one teaching hospital that will be so standard that you don't have to travel anywhere far to go and get some specialized treatment. Those are the kind of things that we should look at, rather than just construction. It's not the building, it's actually the equipment and the personnel, which leads to the all important, how do we stem the brain drain in the health sector? Yeah, the brain drain, of course, cuts across various sectors, but especially the health sector. It's not the hospital, find big hospital that will keep the doctors, nurses, lab attendants that are jackpotting in drugs. It's ensuring that they have proper, remuneration, proper allowances, access to easy mortgages for their houses, making sure their children can go to the schools that they want them to go to, access to vehicles, things that they would get elsewhere. And of course, a conducive working environment. So I think those are the things that government needs to invest in. When they talk about infrastructure, not the construction. Let's start to invest in the people. We've advised this long. Let's decouple the health workers from the normal civil service routine salary regime. Put them on a different salary scale with different maybe per hour, so that they could even work in different facilities and get paid commensurate to what they would be paid elsewhere. We need to look at that, and that could be possible once we can get our health insurance going properly. When we have more people on the health insurance enrollment, then we can get more funding and financing to let this happen. It's very important. So I think one thing leads to another, and they are interrelated. So the infrastructure we should build now is the health workers, the equipment, so that the environment to be able to, I mean, it's very frustrating if you're a doctor and nurse, you don't have the equipment to work with. Then, when you come in, there's no right to work, you have an operation. So let's put those things, let's invest in those things, not the building. Thank you.
All right, in the year under review, we had a couple of vaccines introduced in our national vaccination program. We also experienced rising cases of non-communicable diseases, communicable diseases. What are your thoughts on this development?
Yeah, I think, again, it leads to what was mentioned before. I know the HPV vaccine, which is actually very, very important for cervical cancer, to prevent it, young girls and all. These are things that we shouldn't always have to wait for foreigners to be, because we actually have a high rate in Nigeria as well. It's something which we should be able to do our own R&D, research and development, and produce. Otherwise, we'll again be at the mercy of. And in fact, that has already started happening even with the new HPV vaccine, where I understand that it's even out of stock now. They don't have enough stock that can continue, even though there's been a lot of campaign to actually sensitize the young girls and parents about it. So these are what? In the malaria vaccine, we said how we were not part of the first set to roll out, even though Nigeria has one of the highest malaria incidents, because we didn't get our act together. And then, so we're waiting again for others to actually provide us with something which is strong. We need, and this is where the investment should go into, supporting our teaching hospitals to go a lot into research and development of some of these vaccines with the private sector. It's not just government, but government has to make that, as well as the enabling environment possible so that private sector players in the space with the academia, with researchers, can begin to come together because it needs funding. Any research, any development needs some funding. They should begin to look at doing that. And we should also look at how we can do this interaction with our other African neighbors, because this is something which is a challenge in Africa, that we're working in silos because of our post-colonial heritage. We have to break out of that. We still have South Africa led the charge with regards to the production of the COVID vaccine in South Africa. There needs to be closer collaboration with us within, the ECOWAS region, Southern African counterparts, to ensure that we can actually bring together the best of the best and not wait for vaccines from abroad. We have to prioritize it. It's not going to happen by itself if you're not intentional about doing this. It's something which we need to be intentional to make sure that we can self-sufficient in our own medication. We cannot, no country is safe if we are dependent on foreign people for your health. It's not going to work. So I think the experience we have with the malaria vaccine, that is still not available. I think it's going to be a while before it comes in fully to Nigeria. And of course, the HPV vaccine, which will be desensitization, but now we are about out of stock. These are things that we need to really look at clearly to show that where are we with regards to developing our own medicines, our own vaccines.
All right. Unfortunately, time is no longer on our side, but let us briefly look at Lagos State government, the health sector under this year, during this year under review, as well as your roundup, your call to action.
Yes, I think the major call to action from Lagos State is because they've been so up and doing with regards to the health insurance, the ERA health insurance scheme. The governor has actually, in principle, there was an executive order where the 1% of the consolidated revenue fund is been set aside in furtherance with the law, for the equity fund, which will take care of the most vulnerable in Lagos State. Now remember that Lagos State has about 29 billion estimates from Lagos Bureau of Statistics 2023, almost 30 million population, and the estimates of poverty in Lagos is about 60%. So just do the maths. So we need as much as possible that for the social insurance, for there to be that backup from government to take care of their premiums. So that equity fund, we need the government to ensure that it's actually, the budget is actually allocated. There's been advocacy to make it a first line charge so that they won't have to wait, because this is not something that there has to be back and forth. It should happen automatically so that it goes directly towards, especially at this time where there's a lot of persons that need palliatives due to the economic climate. This is something that, one thing that Lagos State government could do under Governor Bayoji Sanwo-Olu, to ensure that the equity fund is actually being implemented as a first line charge, so that those who need it the most vulnerable in Lagos State, can have access to quality care. It's already there in the law. There's an executive order. I think the main is just to make it happen. And I think once that can be done, we'll begin to see the multiplier effect. Because the whole part of the premium, some part of that premium, will also take care of the capitation, take care of the hospital, rather of the hospital itself, just like the Basic Healthcare Provision Fund. So that will also help to upgrade a lot of the primary healthcare facilities and secondary facilities to ensure that they will be capable of actually giving that quality healthcare to the person they want. So I think that's one major ask, to ensure that the equity fund, one-time consolidated revenue fund for the Lagos State Health Scheme, should actually be implemented and accessible, given to the most vulnerable persons as and when they need it.
All right. Thank you so much, Ayo Adebusoye. Thank you so much. We had so much to say in just a little time. Ayo Adebusoye, Chairman, Board of Trustees, Public Health Sustainable Advocacy Initiative. Thank you so much for your time on reviewing the health sector in the last 1 year.
Thank you. Thank you very much.
All right. Sound Health continues with trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. We believe your hope has been renewed after listening to Ayo Adebusoye, Chairman Board of Trustees, Public Health Sustainable Advocacy Initiative, on how to move the health sector forward for the populace. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.